yeah, when I worked in Mobile, they built their courthouse where they have they got a door to each courtroom, and on both sides there are windows that are probably about this wide. Mm-hmm. And basically had to get there every morning trying to be one of the first two people to get a really good spot at the window. And then on a big thing, you're either like going around somebody's legs trying to.
Isn't Montgomery this way with some of the courts here that like the little slab?
Yeah.
See in Elmore County where I live.
Oh, that's awesome.
They've got a media. The courtrooms have a whole camera area.
With mics and mic'd up and everything.
Malt box, glass. You know.
I'm for moving all these big trials. Moving Elmore County.
Elmore County is the easiest thing to shoot in the world when it comes to. I've never seen a courtroom so.
But what we were told is like they opened the judicial building down there, the government building, like about 2 years before I started working, like in '93 or '94. They opened it up. But when they were building it, they planned each room had like a little conference room beside it, and they had planned to make that whole glass.
I'm live, so
they planned to make that all glass so that the media could go in and just shoot it. But they were asking the media, all the stations, to help pay for it, and they were like,
See, why wouldn't you? You know, well, Jeffco, you get to shoot out in the hallway through the glass, and it's so. And sometimes you can barely see who you're trying to get. And then some judges will let you go in their courtroom so you can shoot through the small window.
Yeah.
But yeah, it just depends on the judge.
And then I like that. I worked in Florida too. When I worked in Mobile, and yeah, they had a pool camera. Mm-hmm. And for a while there, we had 2 stations that were on Betamax and 2 on Super VHS, and the judges were nice enough that they were like, we'll let 2 cameras in, one with each, so you guys can share.
That's awesome.
But I think that's kind of, the public should be able to be in on something like that so they can see what's going on. But
well, we have one judge in Bessemer. He'll let you in the courtroom, but you have to cut your audio off. You get all the pictures you want, and he just doesn't want the audio.
Better than nothing.
People understand why verdicts are the way they are, so they can see what's going on.
No, I agree.
Check.
Walking in the building. Lady goes, what are you in here for? And I said, I work in public health and I work down the shit. They never check on me. Alrighty. Sounds great.
Who do we have?
Confidence in this.
Yeah.
Hey, good morning.
Good morning, Dr. Harris. Sir, how are you?
Good. How are you?
It is a Friday.
That's the good thing.
That's right. It doesn't always matter, but we'll get started here in a second. Okay. Hey, good morning, everybody. Thank you for joining us. It's 10 o'clock. We'll go ahead and get started. Just to remind the callers on the phone, we have everybody muted, so please hit *6 to unmute when it's time to ask questions, and then please mute yourself again by hitting *6 to minimize background noise. We did not do this for a couple of weeks, and so we're happy. We got a few requests for some information, so we're happy to do this, and we'll just do these whenever you all feel that they're helpful. This is just really meant to be a briefing to allow you to ask questions and catch up on any other details that we may have missed getting out to you. Just to remind you now, we're approaching 14 months of this response. Our first case was in March 13th of 2020. We're now almost in the month of May, so it's been going on for quite some time. In terms of our vaccination effort, we're past the 2.5 million shot mark, which means actually 1.5 million Alabamians now have received one or more shots. The actual number from this morning is 1,499,678. So that's 1,499,678. That includes about 1.1 million, a little over 1.1 million people who are fully vaccinated. So we're very pleased with those numbers. Our numbers of first doses that are coming into the state are still around 125 to 130,000 first doses per week. We are going to receive Johnson & Johnson vaccine this week, a new allotment. It's, I believe, somewhere around 11,000 doses, I believe is the number. So we'll have a little more than 130,000 doses in the state, first doses in the state this week. We have a pool that we're trying to reach of about 3.9 million Alabamians that are age 16 and up. Those are the ones for whom vaccine is available at this time. So we've actually vaccinated around 36% of that eligible population so far. We are pleased to report that for our seniors, people age 65 and up, more than 2/3 of that population in Alabama has been vaccinated, and so we're very happy about that. We have vaccine at this point that is found in about 1,368 locations around the state. That includes over 500 clinic sites, 70 county health department sites, 78 community health centers, 99 hospitals, 348 pharmacies, about 87 dialysis centers, and several others as well. So a total of 1,368 sites with vaccine. Vaccine is widely available. We don't see that there are big delays or difficulties in getting vaccine. I know certainly there may be people who feel frustrated that they can't find it exactly in their neighborhood exactly when they want it. Certainly that's true. But there are multiple cases, multiple locations for vaccine in every county in the state. Virtually all of these have some availability, and we continue to get doses, new first doses every week. So please continue. If you're not able to find a vaccine, please just continue to try to do that. We don't think that you'll have much difficulty if you just continue to work on that. We want to remind you, you certainly can continue to schedule a vaccine if you want to do it by appointment at www.alcovidvaccine.gov. That's our site here in Alabama to schedule vaccination with the county health department. You can also go to www.vaccinefinder.org. That's the site put together by our federal partners that will allow you to search for vaccine sites by vaccine product, if that's important to you, or by which products are available for which ages, if that's important to you, if that's what you need to do. So those resources are all out there available. Our website continues to show the sites of all the available locations you can get vaccine, including federal pharmacy vaccine providers, as well as all the others. The big news since we met previously in this setting is that the Johnson & Johnson vaccine, as you know, was paused, and then that pause was lifted over the weekend. We began giving vaccine again in Alabama right away. Most of those providers who had J&J, or many, if not most of them, still had that product. That product has an expiration date that's a couple of months in the future, so that product was available, and many of them began giving vaccine again right away. The temporary pause is over. We still think this is a safe and effective vaccine in most cases. There are no restrictions on the use of it. What CDC has stated is that women under age 50 should be aware that there's a very rare blood clotting disorder that can be associated with this vaccine, but it's certainly not contraindicated. Out of about 8 million shots, I think there were 15 cases of this illness that were found. So I would just remind you that for COVID infection, people who are infected with COVID, about 2 out of every 100 cases we see do not survive. About 2% of people don't survive. So yesterday we had around 400 cases of COVID in the state. That's not a real high number, but statistically, we expect maybe 15 or 16 people not to survive that illness, unfortunately, as compared with these very rare cause of blood clots with the Johnson & Johnson vaccine. There have been only 1 or 2, I think, total deaths even out of that 15 cases that have been reported. So it's a very unusual thing. The risk of COVID is still much greater than the risk of any harm that you might get from the Johnson & Johnson vaccine. So we continue to use that vaccine. Our National Guard partners have done a terrific job rolling the vaccine out in many of our most vulnerable counties. This is the third week of the second time around. This is the third week of second shot clinics. Today will be the last day. So they've been going now actually for 6 weeks. And today they're in Barber County and Conecuh County finishing those clinics. They have also begun giving Johnson & Johnson again this week once the pause was lifted. So when people who have not received any shots present, they can get the one-time, one-and-done shot since they would not be able to come back to that location for a second shot with the other products. The National Guard is going to start on May 10th, sending smaller teams that we're going to call mobile support teams to each one of our public health districts. These are going to be much smaller teams. They're going to be much more focused on particular populations, some of our hard-to-reach populations like group homes or people who are homebound or others that just have difficulty traveling to where a provider site may be. Our mobile support teams are going to have a nurse or other provider, 3 medics, 6 general purpose staff that'll do things like data entry and observing people after shots and so on. We're very, very grateful to have our Guard partners helping us with us. The state of Alabama is really fortunate to have these men and women who are doing such a terrific job, and we are very, very happy to have them with us. We continue to have a federal FEMA community vaccination center that's located at Watermark Place in Bessemer. That's near the, as you know, the big amusement park there in Jefferson County. That CVC, that community vaccination center, is set up to offer as many as 1,000 shots a day. We have not seen anything like that in terms of demand. We are, averaging somewhere around 120 or 130 shots per day, so not a large number at all. We're using some of those team members and vaccine to actually go to other locations in the area. They're not only at that site. We vaccinated at a high school earlier this week, for example, for teenagers who were 16 and up and eligible to be vaccinated. So we're looking for other ways to get those shots out to people who aren't able to come or are just not coming to the central location. We expect them to be here a few more weeks, but obviously it depends on what the demand shows, and we'll make that determination depending on how many resources are required to keep sustaining that, and what the turnout seems to be. I wanted to mention to you a couple of things on variants. We are continuing to see viral variants here. Right now we've had approximately 400 or so that have been identified. We certainly expect that we have a lot more than that. Overwhelmingly, these are the UK variant, but we have also seen smaller numbers of other variants as well. As we've told you before, the P1, or the so-called Brazil variant, has been seen here. The so-called South African variant, which is 1.351, and then the 2 California variants as well. So those are all seen in most places in the country now, as well as here in Alabama. And we'll continue to update that information as we do more testing. We don't have as widespread a testing for this genotyping as we would like, although we still have several commercial labs and academic centers that are doing that in the state now, but we continue to try to increase the capacity to do that. We are working to identify breakthrough cases in terms of people who've been vaccinated and who develop illness afterwards. We have now identified about 401 cases of people who were fully vaccinated and yet became infected later. Remember that we've vaccinated about 1.1 million people fully, and so that's not a particularly high number at all. These vaccines are said to be 95% effective. That's actually much higher than 95% protection as far as we know. We do not know of any instances in which breakthrough cases involved anyone with serious illness or hospitalization or death. We're certainly looking very carefully to make sure that we know that for a fact, but at this point it does not seem that any of these breakthrough cases were associated with any kind of serious illness, which is consistent with what other people have reported around the country. In terms of reinfections, these are people who've been previously infected and then have been documented to have a new infection. At this point, we have around 1,115 cases that we know about, 1,115 cases of people who were infected at one point and then later on became infected again. About 415 of those were symptomatic cases. We know that about 228 were not symptomatic, and we don't have the information on the others at this time. But again, certainly that's consistent with what we know about COVID. Previous infection does not necessarily give you long-lasting immunity. It probably does give you temporary immunity in some case, but probably not long-lasting in most cases. Just to remind you on our demographic information, we do care very much about vaccine equity. We care very much about vaccinating those people who are most at risk for serious illness and hospitalization and death. In Alabama, people of color are the ones who are most at risk for serious illness and for hospitalization or death. We, at this time, have given about 19.1% of our vaccine to African Americans in the state, about 55.7% to white Alabamians, and then another 20% that we don't have information on at this time. So that number continues to increase in terms of reaching our black Alabamians. That's not as high as we would like. African Americans represent about 27% of Alabama's residents, so we still have a way to go in reaching the goals that we want to reach there. We continue to try to address hesitancy. We have a lot of communications campaigns that are out working at hesitancy, working on the hesitancy issue. As you know, hesitancy is a really a whole jumble of different concerns and different reasons and different causes. There's not one single cause of hesitancy, and there's not one single demographic group that's hesitant. There are lots of forms of that. We are doing things including lots of outdoor advertising, TV and radio advertising, social media advertising. We actually have a group that's doing door-to-door visits with pamphlets and providing information. The goal is to reach about 21,000 households by directly going to their homes to give them information on that. We continue to try to emphasize the importance that medical professionals play in the vaccination effort in terms of educating their own patients and giving credibility to the idea of getting vaccinated. We have sent out messages to all providers in the state asking them to reach out directly to their patients and ask them to get vaccinated. The real simple approach of using your own cell phone to record yourself saying why you think the vaccine is important and then sending that to your own patients is a very powerful tool. And many people who don't necessarily listen to media or public health or celebrities' endorsements will listen to their own healthcare providers. So we would encourage them to continue doing that. There was some guidance earlier this week released by CDC related to fully vaccinated people. And I'm sure most of you have seen that, but fully vaccinated people do not need to wear a mask outdoors in just about all occasions unless they're in really crowded venues or settings. For people who are fully vaccinated, they can certainly continue to meet without mask indoors with other fully vaccinated people in small groups. With people who are not vaccinated, if those unvaccinated people are not at high risk for disease, then fully vaccinated people, again, don't need to wear a mask. We want to continue to push this message that there are some real tangible benefits to being vaccinated. We want people to be vaccinated because this is how we get back to normal. This is how we can get to the point where we don't have to wear masks and we don't have to worry about distancing and we don't have to worry about crowds. So we hope people will take note of that. and that'll be one reason for them to want to get vaccinated. So that's all the prepared comments I have, but I'll be glad to answer any questions. Yeah.
You mentioned with schools, yesterday I was at one of the schools in Birmingham where they had passed out 400 packets to families and only received about 10% back. How do you guys combat that they're still, and you kind of touched on it, with getting them over the hesitancy that if they want to get back to a normal, quote-unquote, normal school year, to kind of encourage these parents to get their 16 and older kids vaccinated?
Yeah, you know, there's not really one simple answer because, you know, even among these groups of parents that have kids, they have a whole lot of different reasons probably why this one is not getting vaccinated or that one's not getting vaccinated. I think our, you know, best efforts, again, are going to involve trying to recruit the doctors and healthcare providers that care for those kids. I spoke to a pediatric association group a weekend before last to try to make that same appeal to them. We know as we get a vaccine that's available for even younger teenagers, you know, then pediatricians are going to play a really big role in reaching school kids. We don't know anything for certain other than what we, you know, sort of what we see in the media, but it seems like there could be, the Pfizer vaccine might be authorized, you know, sometimes in the next 2 to 3 weeks, possibly for children as young as 12 years old. So I would just remind people that if we're going to get back to normal, we're going to have this disease stop circulating. We're going to have to stop having deaths every single day in Alabama, which is what we're having right now. We want kids to have a normal summer. We want kids to have a normal fall and a normal school year, and you know, their normal activities and football season and all those things that they want to do. And vaccination is going to play a real important role in getting there.
With the vaccine.
Dr. Harris, yesterday on your webinar, you mentioned that Alabama hit a wall. How do we break the wall, and what do you think of incentives if people get shot?
A wall of, are you talking about just hesitancy there? Or?
Yes. When you were talking in your webinar, you said you may hit the wall.
Yeah. I mean.
Break the wall. And what do you think about incentives? West Virginia, even Dr. Hicks mentioned on that webinar, is something they would look at.
Yeah. So I would say I don't know if there's a solid wall that we just can't get across, but I think we certainly are encountering hesitancy. I think the people who really wanted to have a vaccine as quickly as they could get it, you know, most of those people have been able to get it, and so now we're left with people who maybe aren't opposed, but you know, maybe have problems of access. It's just not convenient to them, or maybe they just need more information, and so we continue to try to put that information out there. I would say I think if you could identify one single issue that's a problem, is that there are people who are just convinced that the vaccine somehow is more dangerous than the disease itself, and that's a false belief that we have to try to combat as often as we can. It's simply not true. I mean, you know, by any measurement, that the disease is clearly a deadly illness, and statistically, you're much more likely to become really sick and or even die from the disease. So that's a real problem that we're trying to combat, and you know, we just hope people hear that message, and we would encourage people who have questions or who aren't sure if the vaccine's for them. You know, please ask your own doctor. Please talk to your provider. Ask them. You know, the reports we have nationally is that somewhere around 95% of doctors who've been offered the vaccine have taken it themselves, and you know, to me, that's a really powerful statement that the people who know the most about the disease believe the vaccine is safe and effective. Yeah.
Dr. Harris, when you kind of travel throughout the state, some of the more bigger metropolitan areas, Birmingham, Montgomery, they have city mask mandates in place. You get out into the rural areas, kind of where I live, but I can walk into a gas station and nobody has a mask on. Been to baseball games, no one has a mask on. There's 100 people there. Are you seeing any, as far as the numbers from counties, are you seeing that correlate between the bigger metropolitan areas and some of the rural areas?
In terms of cases, you mean?
Yes.
You know, cases are low everywhere right now, thankfully, and so I don't have any information that there's a direct correlation there. I don't think there's any reasonable person who thinks masks don't work. I know there are people who take, you know, partisan positions on that still, unfortunately, but you know, the science has settled on that issue. Masks are effective. We still encourage people to use them in certain situations. I think our knowledge has evolved as you know, this pandemic has gone on, and we're starting to understand now that disease transmission is not really that likely. Outdoors disease transmission is really unlikely in groups of vaccinated people. There are lots of situations in which, masks are optional. But, for people who are really vulnerable, particularly when you're mixing with people who aren't vaccinated or people whose vaccination status you don't know, like in a group or at some public event, masks still make a lot of sense.
Dr. Harris, Brendan Kirby from Fox 10 News in Mobile. The state's positivity rate has crept up over 5%, which I guess is a warning benchmark. And also, you put Mobile County into the very high risk category. I was wondering if you could just kind of walk through what the factors are in determining that high risk and how concerned you are about the positivity rate statewide, even though the cases are much lower than they were three months ago.
Yeah, our percent positivity rate, in some sense is better than we have ever seen it. I think it's in February it got down below 10% for almost the first time ever. Almost the first time since this began, and it has been consistently around 4.5% to 5% for the past 2 months. So we've been encouraged by that. But as you say, it has ticked up a little bit in the last week. We were at 5.4% last week. That's the last full week for which we have data. And so, obviously we're watching that very closely. We know that about a little more than half the states in the country now have cases that are increasing. We don't really see our case numbers or our hospitalizations or our numbers of deaths increasing at this time in Alabama, so we're very thankful for that. Clearly, the more people we vaccinate, the better situation we're going to be in. But it certainly does bear watching, given what we've seen in other states. The methodology for calculating that risk status that you referred to on that color-coded risk dashboard is actually explained on the dashboard, and that if you care to dig down into all those details, but essentially what changes your risk status is what direction your cases have been going over the past couple of weeks. Are they going up or are they going down? And so even when you have a small increase in case numbers, may not be a lot of numbers, but if the numbers are actually increasing, if your cases are going the wrong direction, that's what's going to change your color on that dashboard.
Right. I get the methodology. I guess I didn't ask it right. What I meant was, is do you have any theories as to why that's the case in Mobile County and not the surrounding counties or most counties in the state? I think there's only maybe a half a dozen or less that are in that very high risk. Any idea why particularly that might be occurring in Mobile?
Yeah, I don't have any particular event or outbreak or concrete reason that would explain it. I think one thing we really learned about this disease is that there's a lot we don't know about this disease, and as we've kind of said this a lot over the past year, but it's never been this giant deluge that's flooded the whole state at once, except for maybe the holiday season in December. But most of the time the water kind of rises at different rates in different parts of the state, and we don't always understand why that is. So we are seeing a little bit more of what we saw really early on in this, where you just have spikes in your numbers here and there in these different isolated locations, but not in between. And I have to say I don't know exactly why that's going on.
Dr. Harris, with the small incidents with the J&J vaccine, how do you put people's mind at ease that since it's now back in circulation, that it is a safe vaccination to take?
Yeah. Right now the very best evidence that we have is that there's a 1 in 500,000 chance that you might have a blood clot. That's not necessarily a serious illness. That's certainly not your risk from dying, which is much, much rarer than that. We believe this is a safe and effective vaccine. I think the fact that it was paused by CDC to review the evidence is a really good sign that the safety process works, and that they recognize really early when there were tiny numbers involved that, hey, we need to look at this more closely, and they have. And so we've had the ability to monitor that deliberation that these medical experts have had and look and see the evidence that they've seen, and we believe this is a safe vaccine and it's effective. If you're a woman under age 50, there's again about a 1 in 500,000 chance that you could have a complication, but not necessarily a serious one. We know for all people in Alabama, though, that about 2 out of every 100 who get COVID are going to die. And so the risk of anything happening with this vaccine are much, much less than the risk of getting infected with COVID.
Dr. Harris, with everything that we're seeing now with vaccination rates declining as you thought they might, but we're still getting people vaccinated, are we still on pace to by midsummer, as the president had talked about, to kind of get back to more of a sense of normalcy? Where do you feel that we're headed in the next couple of months?
Yeah, I would have to say there's a real sense in which we're more optimistic than we've ever been. You know, we still don't know how to, predict the future, obviously, but the president has said he hopes people can have a somewhat normal 4th of July holiday. I think that's a very, very reasonable goal and something that we can reach here in Alabama. We have had a lot of discussion about this herd immunity concept and what does that mean and so on. There's not a real simple, straightforward way to answer the question because we just simply don't know so much about this disease. But what we do know is that vaccination prevents illness and vaccination saves lives, and vaccination is the fastest way for us to get back to normal. And if we want people to have a normal summer and a normal school year and a normal football season and all those things that we enjoy doing, we're going to have to continue to get people vaccinated.
Dr. Harris, would you be able to talk a little bit more about the normal year?
I just want to ask you real quick about follow-up on those incentives. Do you have any faith in incentives West Virginia's governor wants to do a savings fund to get people to get shots?
I saw that story about that. I thought that was pretty interesting. We have had some discussions about how to incentivize people. We certainly haven't made any decision to do that. I think there's a lot of issues that have to be considered before you do that, and we're certainly not ready to do that so far. I've seen some states are paying people to drive other people to get vaccinated, for example. That's certainly one way to bring people, that you're not necessarily paying for vaccines, but you're making it easier for people to get access to vaccines. There's certainly some places in other states that have done things to incentivize people, not necessarily requiring vaccination, but allowing entry for one price if you're vaccinated or another price if you're not, or requiring you to be tested for entry if you're not vaccinated, or otherwise you can come in if you're vaccinated. I think there's a lot of those things that incentivize people that aren't necessarily involving cash payments. I think there's just a lot of discussions that need to be had, and a lot you have to think through when you're if you're convincing somebody that they need to make a medical decision based on you giving them cash. There's just some implications to that about who's going to be incentivized by that and who's not going to be, and so I think we just have a lot more to consider before we take that step.
Dr. Harris, could you talk a little bit more about the mobile units, which is at the top of the chapter? How many units are going to be sent out, and how many shots are they going to be able to give per day? And also, who and how are the sites being determined, like there's group homes and other things that you were mentioning?
Okay, I'm sorry, I missed a little of the last part of that, but the mobile sites, we are going to have teams in each one of our public health districts that we have. As you know, we have 8 public health districts. We're working with our home county health departments who are identifying people in those areas who need to be vaccinated, who need to be reached. We have been meeting with several of our sister agencies that have relationships with people who fall into these categories, people like Senior Services and Department of Mental Health, Medicaid, Rehabilitation Services, several others. There are a number of state agencies that have constituencies that are, in the, somewhat hard to reach population in a way because maybe they just can't travel as easily and so on. We don't really have a set number on how many per day, but I can tell you it's a low efficiency model. You're many times going to a rural area to vaccinate one person in a household one at a time, or one person and hopefully maybe their caregivers, just a couple at a time. So it's not, excuse me, it's not going to be huge numbers of people at a time, but it is a way to reach people who can't be reached otherwise. And I believe I gave you the breakdown of the team, but we have again, we have a great relationship with the Guard. We have them, as far as we know, available to us certainly through the summer, into September at this point, we know. So we're going to continue to try to work with them as long as there's a need for that.
Dr. Harris, this is Kate Smith with 48 News in Oakville. Yesterday, Alabama Rise announced a new study that saying that, I think it was 40% of the COVID deaths in Alabama were with people who didn't have health care coverage. My first question is, I guess, your reaction to that, and then what are y'all doing to kind of target that group to make sure they get the vaccine or care they need to prevent this?
Sure, that's a great question. I did not see that study. I don't. I would say I wouldn't find that surprising. Although I'm not quite sure how they identified that information, but I would like to review that. I think we know that people without access to care always bear the brunt of illness and death. No matter what health indicator you're talking about. So again, I'm not surprised by that. We have thought all along about how do we reach the people who are most at risk, and clearly people who are uninsured or just don't have access to care or don't have a normal provider relationship, or people who are going to be at very high risk. We certainly understand that. A lot of what we have done is to make sure that we continue to stock our county health departments who often have relationships with people that don't otherwise have any access to care. A lot of people understand that they can connect with their county health department when they don't have another way to seek care. It's a good time to remind everybody that the vaccine is completely free to people who want to get it, no matter who you are, no matter whether you have insurance or not. If you have insurance, your provider may bill your insurance just for the administration charge, but the patient themselves are never going to be billed. There's no charge to anyone for that. We, as part of our ideas about vaccine equity, we developed this whole program with the National Guard to go to our most vulnerable counties. We went to counties in the Black Belt and in the Wiregrass over the last 6 weeks, because these are counties in many cases that don't have very many providers. They don't have high rates of private health insurance among the population. Many of them don't have hospitals in the community, and so on. So these are the high SVI counties that we've been targeting for just those reasons.
Dr. Harris, the Pfizer vaccine could soon be available to children ages 12 to 15 as early as May. Just what are your thoughts on this?
We've kind of heard the same story. We don't really have any inside information on that, except that, hopefully it will be. In Alabama, somewhere around approximately 20% of our population are going to be children. And so, getting to whatever this herd immunity concept actually is, or getting the disease to stop being passed around, is going to involve vaccinating, a significant number of those people probably. So we're excited that we may have a vaccine product that'll be available soon, that'll be safe and effective for that age group. We just hope it comes sooner.
Dr. Harris, are we at a point where anyone who wants to get a vaccine can get a vaccine?
Yes, we absolutely are. Again, I certainly don't want to be glib and say there's no barriers anymore. Clearly, people certainly do have barriers in their lives. They may not have good transportation. They may not be able to easily get off work. They may just not have, a relationship with a provider who can answer questions for them. There are clearly barriers that exist. But in terms of the absolute number of doses we have in our state, we have plenty to go around, and we have vaccine in multiple locations in every county in the state. And so I would say, generally speaking, everybody who wants to get a vaccine can get a vaccine. Okay. Anything else? All right. Well, thank you guys for joining us. We appreciate it.
Thanks.
Have a good weekend. Thank you. All right. Thanks, Ron.